I'm Governor John Carney. Thank you for joining us again for our weekly press conference on Delaware's response to COVID-19. Joining me today is the Director of the Division of Public Health, Dr. Kara Rattay, as well as our Director of the Delaware Emergency Management Agency, A.J. Shaw. Thanks for joining us again this week and for the good work that you're doing with all the folks on the front line at the Division of Public Health, now 7 months plus in, and those in the law enforcement and first responder community, AJ, and you as our testing czar. I know you've got really interesting and impressive statistics to share today, and we'll talk about and illustrate the efforts that are being made over the last number of months in understanding the spread of COVID-19 in our communities here in Delaware, and the effectiveness of our outreach, our testing, our contact tracing, our isolation. Particular thanks again to our hospitals and healthcare providers for the tremendous work that they do on a day-to-day basis. As you'll see in a minute, we have seen some increases in hospitalizations, and so we know that those frontline nurses and hospital personnel are again ramping up and doing an excellent job treating people that have acute problems of COVID-19 in their facilities. It's a development that's concerning to us and one that we'll keep our eye on, particularly as we move into flu season and see some of those flu cases that require hospitalization. Before we get to our data dashboard, where we always start each week, I do want to talk just briefly about a development that occurred yesterday. The Chancery Court accepted a settlement agreement between the state and advocates for low-income children, those with disabilities, and English learners in our state, really putting into an agreement our commitment to these children, the schools that service them up and down our state, and to make commitments to funding programs that we're already committed to. Chief among them, opportunity funding, which is a funding mechanism that we started in the beginning of my administration. We've committed to increase that funding to $60 million a year going to schools based on the number of students they have that fit this criteria. It's weighted student funding. It will grow with the increase in enrollment beyond 2025. So by fiscal year 2025, we will increase opportunity funding to $60 million a year. We did make an original commitment of a 3-year funding at $75 million, some of which was directed towards reading specialists and other services. And I know that members of the General Assembly have been supportive both of opportunity funding and the other programs in this settlement, which includes doubling the funding for our Early Childhood Assistance Program, ECAP, to expand that access to early education. We know that's a really good way to get all children off to a good, strong start so that they can read at grade level by grade 3. To provide full funding for K-3, kindergarten to grade 3, basic special education, another thing that we've started on that's a priority for a number of our state legislators, particularly Representative Kim Williams, who's been an advocate for this, and many others have as well. And then, among other things, providing additional funding for teacher recruitment and retention in high-need schools like those that we've been working with in the city of Wilmington and the Christina School District. So all of these measures and commitments are a continuation of programs that we've committed to already with strong support from members of the General Assembly. This agreement puts some specificity around the amount of expenditure towards each of those programs. It also includes a commitment to evaluating the success or not of individual initiatives here, so we know what works and what doesn't work. We already have a committee set up, a statewide committee of educators looking at the first couple rounds of educational of opportunity funding to determine what's working as we try to make sure that every child in our state, including those from disadvantaged backgrounds, English learners and children with disabilities, have an opportunity to be successful in life. So a very important development that will avoid litigation and spending money on lawyers and in court to actually making those funds available for children and teachers and educators across our state. So we look forward to the implementation of that. So let's move to the data dashboard for this week. We're up, closing in on 25,000 total cases since our first case back in March. 600, almost 660 total lives lost, sadly. And then the number that I mentioned earlier, the current hospitalization number at 112. We had gotten down as low as 40, I believe it was, during the summertime. And we've gradually been moving that number up. I think in part it's a function of the recent outbreak that we've seen in nursing homes across our state. That's the most vulnerable population, which we really tried to protect, and many of those residents and neighbors find themselves needing hospital care. 19 of those individuals are in critical condition, so we pray for each of those. As the cases by county, now 1,100, over 1,100 positive cases in Newcastle County. We'll see in a minute. We've seen a little bit of an increase in positive cases in Newcastle County. The cases, as you'll see in a minute, in Newark have flattened out, which is a good thing. Kent County stays pretty steady in terms of the number of positive cases, the growth in them on a day-to-day basis, the percent positive. Not a lot of spikes anywhere in that part of our state, and hospitalizations have been pretty steady as well. Sussex County is where we see the most extensive spread, going back to April, where we had the outbreak in the poultry processing plants, and since then in communities across Sussex County. We've seen some increases more recently on the western side that Dr. Rattay will talk about. So the highest rate of positive cases is there in Sussex County, and need to continue to get the word out about the protective measures that folks can take, particularly wearing face coverings. And so we've talked a little bit about changing the methodology for evaluating our percent positive, saying or illustrating that the denominator in that fraction is getting smaller when you talk about the top methodology, where we use the percentage of persons that are tested positive. So each time that person gets tested a second time or a third time, it doesn't get counted for that calculation. The new way, which is the middle column there, is we will determine the percent positive by using all of the tests. For instance, I've been tested now 3 times. I would only, in the top calculation, be counted once, and then in the bottom calculation, I would be counted 3 times. And so we are testing teachers over and over again, and we expect to do that. We're testing, I would expect, students over and over again. We're testing employees over and over again, obviously for frontline workers. And so, and you'll see this in a minute, that number of total tests is going to be much higher than the number of persons that are testing, and so the difference in the measure. We will continue to look at both of them as we make a determination of how extensive the spread is and the conditions there, and that will be dependent on what the numerator looks like, which is the number of new cases as it relates to those tests, and the denominator, which is the total number of tests or the total number of persons. And so you can see the bottom measure is that new positive cases per day on the 7-day moving average at 136. That's much higher than where we want it to be. If you remember back in the summer, the targets for staying off the quarantine list in New Jersey, New York, and Connecticut was 97. And we were bouncing around above 97, below 97. We got below 90, and I think as low as into the 70s there in mid-August, and then things started trending upward. We are testing more people, and AJ will talk about that, so that does drive that new cases per day number up, and that's why you have to look at both the new cases per day and the percent positive, the number of tests that generate those new cases, to understand the full picture in terms of spread. And so as we start to talk about reopening schools and how the conditions, the health conditions in communities affect the safety there, you have to look at all of the data that we have, and we're continuing to do that, and Dr. Rattay will talk more about that in a few minutes. And so up next is our rate of positive cases. Again, that young adult group continues to separate itself from the rest of the population. We really do need to lean into making sure that we're getting the message out to those 20-year-olds and 30 to 35-year-olds, because they're driving a lot of the new positive tests really across our state. And a lot of it's coming from unstructured social activities and areas, indoor places where people congregate, and just folks need to be very careful there. So let's take a look at where we've been. Here's the 14-day view. You can see that hospitalizations is trending up. On the top far left, in the middle on the top, the hospitalizations, new hospitalizations per day, the hospital admissions. You can see recently it was trending down a little bit, and so since the total hospitalization is moving up, we can expect that people who are being hospitalized are maybe staying there longer. New positive cases, again, is flattening out. It's flattening out at a rate that's higher than where we want it to be, although the last 3 days have been in the right direction. So down on the bottom level, the far left and the middle left, you see the two ways of calculating the percentage of tests that are positive. So that's all the tests that we do on the denominator. That's going to be a lower number. And then the middle graph on the bottom level is the percentage of persons tested positive. So that's going to be a higher percentage because, for instance, when I got my second test, that test was not included in the calculation of the percent positive. And so when the next time we test teachers in their interval each month, every additional time they teach under that old way will not be included in the denominator. So if we look at both of those, we get a better picture of what that percent positive is. Today, I think the moving average for percentage of test is about 2.5%, and the percentage of persons testing positive is just above, I think around 6%, with the average being 5%. I'm sure that Dr. Rattay will correct that if need be. If we look at the 90-day view, you can see where we really kind of hit the bottom, the best place where we were in kind of the early August period of time, and then things as we came to the end of the summer, and as we moved into testing more people, the percentage of persons testing positive went up there. Actually, the percentage of the tests that were positive was still pretty flat. But new positive cases and hospitalizations are on the rise. Actually, new positive cases are flattening out now after having been on the rise. And current hospitalizations, which is a lagging indicator, again, is on the rise and something that we're looking at. Hopefully that'll peak and then head down the other side and decline as we hope new cases decline as well. So data dashboard, we're still waiting for that order of protective gloves to be delivered. Everything else looks pretty good in terms of our inventory for personal protective equipment. Again, so much of the data analysis goes towards determining the health conditions in communities for the reopening of schools. You'll remember that we have 3 scenarios, 3 criteria that to this point we've been looking at. We're actually looking at expanding this dashboard to give us more information. But for the time being, if 2 of the 3 measures are in the yellow scenario, then we are in a remote learning position, meaning schools can have, a hybrid condition, which means schools can have a mix of in-person and remote learning. Most school districts so far have chosen to be completely remote, although in talking to the individual superintendents, as I have over the last 2 weeks, they are each planning, those who are remote are each planning to convert, bring students in-person instruction. Most are focusing on the children with learning disabilities and the elementary children, to bring them back first as we move into the end of October and into November. Very difficult and challenging decisions to be made. So we're in the two of those criteria. The new cases per day is in the yellow. It's starting to turn and go down a little bit. The percent positive, again, under the old measure, was going up. Now it was up around 8% last week, and now it's headed in the right direction at 6%. We want it to be under 5%. And then, of course, the average new daily hospitalizations is still in the green category, as it's been for some time. So we'll continue to look at these three criteria, and I know the superintendents are doing that as they each and every one plan to bring back some number of their students, mostly focusing on elementary students and children with disabilities, bringing them into classrooms for in-person instruction. We know that two of the most important things that you can do to help us prevent the spread and push down the number of new daily positive cases is to keep wearing your mask when in public, especially when you go into indoor spaces, contained spaces like the grocery store, like your hardware store, your retail establishment, anything like that. Wear your mask when you're not able to keep the appropriate 6-foot social distancing outside of your household. So everybody should be wearing a mask. We know that's the most important thing that you can do, and the strongest tool for fighting the virus and getting our children safely back in school. Just to remind those of you who are associated with nonprofit organizations that we have a $25 million relief fund, and we're still taking applications for it. You can learn more about it and apply at decaresfunds.org. That's decaresfund.org. I would also bring your attention to our Rapid Workforce Training and Redeployment Initiative. These are funds that are available for individuals that are looking to get training for jobs that are in high demand in the workforce right now. And ironically, I hear from a lot of employers that they're looking for people to fill jobs that they have open. These particular trainings and dollars go to individuals who want the certificates in healthcare, in the construction and trades, where there's a lot of construction going on out there. It was a sector that we did not close down over the last 7 months. In hospitality and food service, in logistics and transportation, Delaware's seeing a real surge in employment and businesses on the logistics and transportation side. And then, as always, computers and information technology, lots of opportunities there for folks that have the training and the expertise to do those jobs. So take advantage and look at our Rapid Workforce Training and Redeployment Initiative at forwarddelaware.com. You can get the information. You can call the Department of Labor that's working with the Workforce Development Board, Gary Stockbridge and his group, as well as Dr. Brainerd at Delaware Technical and Community College, which has responsibility for a lot of that training. So with that, I'm going to turn it over to Dr. Carol Rotte to talk a little bit more about testing, to talk a little bit more about those health criteria that we've been evaluating so that we have achieve a greater understanding of the health conditions on the ground and in communities in our state.
Great. Thank you so much, Governor. I want to start today with just a couple of updates on our COVID-19 data dashboard. We have now hospitalization data available at the county level. So if you go into My Healthy Community, you will see overall hospitalization rates, but also by county. So from this, you can see over the last couple of weeks, some slight increases in Newcastle County hospitalizations. Kent County has been stable for a while, but we've seen some more significant increases in Sussex County for hospitalizations. We've already talked about the updates for percent positivity on our website, but that did go live yesterday. So when you go into our website, you can toggle between percent positive, which is based on total tests, and you can also toggle over to percent positive for people tested. As we talked about last week, they both measure something just a little bit different. So people tested measures more, so kind of the overall burden or prevalence of people over time in our state, but total test is a really important metric, very helpful for understanding community spread, but also how are we doing in regards to testing. It was important for us to update this, this metric and add the total test metric to make our data consistent and comparable across states. CDC is using this, Johns Hopkins is using this, New York Times, and others. So again, it was important for us to have comparable data across states. And so you'll be noticing those changes on those different dashboards over the coming weeks. And again, you can see just from a mathematical perspective how they differ and why they differ. When you're using the persons tested, right now our denominator is a little over 300,000, so over 300,000 Delawareans have been tested. When you use total test administered, we've had near 500,000 tests that have been administered in our state. And so that is why these two numbers do differ in value. Let me talk about areas of concern in our state. Some have persisted, but we've seen some changes. So you'll notice that Newark isn't highlighted. I'll talk about that more on the next slide. In Wilmington, 19801 continues to have a little bit higher case rates, but in general, we do seem to see some settling or some decreasing in those warmer spots that we had been seeing in Wilmington. Western Sussex also, the spots we've been keeping an eye on, Laurel and Bridgeville, still remain slightly elevated as far as case rates, but we're also seeing some other areas in the state that we have our eye on. So Georgetown for a while has been a pretty quiet area. We haven't seen a lot of cases. Same with Lewis. Those are two areas. Over the last week, we saw some of our higher changes in case rates, as well as Ellendale, Camden, Wyoming, and Brandywine 100. So as you can see, there's really spots all over the state that we're keeping an eye on. It's been changing a little bit week to week. In general, there's clearly no hot spots in our state right now, but some warmer areas that we're just going to keep leaning into and really trying to get the message out across our state, but especially in those areas for people to get tested, since there might be a slightly increased level of community spread. So let's talk about Newark. Thanks, Jess. Let's talk about Newark, which is some good news. If you look at the yellow boxes, you can see there that on September 6th was the week where we saw the highest number of cases among our University of Delaware students. So the yellow boxes are University of Delaware students. The blue boxes in this chart are Newark as a municipality, and gray is the state as a whole. So September 6th, we saw the highest number of University of Delaware cases at 95. This past week, we had less than 8 cases for the University of Delaware, which is great news. In Newark, we have seen a slight increase of non-University of Delaware students, and that was at its highest on the week of September 27th and has decreased slightly in the last week. So again, we're paying close attention to University of Delaware and Newark, but overall, you can see that it's quieter in Newark as far as cases this past week than it has been in well over a month.
Yeah, Dr. Rattay, if I may just jump in, I wanted to just take a minute to to thank President Hassanis, his team at the University of Delaware, Mayor Clifton, and the folks at the police department there in the city of Newark, all the students and faculty at the University of Delaware, and the residents of Newark. You're really doing an excellent job. As we saw this outbreak here, there was a lot of cooperation between town officials and the University of Delaware. Lots of testing that took place, AJ. Thanks for your team for reaching out. And so far, we've seen kind of a flattening of those cases. And part of it, I think, was that we got a little bit, that we knew it was coming because we saw it in campuses and states across the country. And then when it came, there was a seriousness of effort both at the university, in the city of Newark with Mayor Clifton and his team, with our teams, and really trying to get ahead of it and to take it seriously. And the University of Delaware really did. They most of this activity or these cases were coming on off-campus social activity, or at least a lot of it. And so our hats go off to them. Let's keep up the good work. Let's wear our masks. Let's pay attention to social distancing, observe the limitations in social gatherings off of campus, and let's keep those numbers down. So thank you to everybody there at the University of Delaware and in the city of Newark.
Great, thank you, Governor. Yeah, we're happy to see improvements, but we're going to keep a really, really close eye on the situation and continue to partner.
Over till it's over, right? Let's not spike the ball yet.
That is right. Let me provide an update on long-term care cases. The three facilities that we've been talking about over the past few weeks, Kentmere, Cadia Healthcare Silverside, and Country Rest Home, all have seen a few additional cases in the last week, but in general, those situations seem to be stabilized at this point. We're monitoring Regal Heights Healthcare and Rehabilitation Center in Hockessin, which has a combination of 14 residents and staff. Overall, though, across long-term care, cases here and there, but no additional outbreaks, which we're happy to see. Really grateful to the partnership with our sister agency, Division of Healthcare Quality, and with the long-term care facilities, really together. I think everyone has leaned into this situation, going back to weekly testing, which we think is really critical to keep this under control, as well as infection control within facilities, recognizing that there's a high turnover of staff in these facilities. We've recently required a repeat of some updated education and training in the facilities, which all staff in these facilities must have completed by this Friday. So we're going to continue to work hard in partnership with others in long-term care in hopes that we can really prevent additional outbreaks in these vulnerable facilities. I want to talk a little bit about social and family gatherings. These are settings that remain a really significant concern for transmission risk. As we look at the information that comes out of our case investigation and contact tracing, we see a number of cases in our state where we've had exposure to multiple people in a house party setting or other social setting where people are together. We've certainly seen that nationally as well. Here in our state, one example is a house party where 50% of susceptible individuals became positive after that house party. And then it's easy to see how when you have a cluster of infections like that and everybody goes back to their life of going to school or teaching or working or spending time with others, how then you get more community spread from those clustered events. This right here, this infographic, comes from the Centers for Disease Control and Prevention, and it was an in-depth study that they did with 4 health departments focused on one house, so one family gathering that involved 20 people. 14 relatives were all in a house. They didn't social distance, they didn't wear face coverings, and 12 out of the 14 were positive, became positive over that time. So one was already positive, so 11 became positive. Only 2 did not become positive from that setting. There were 6 other relatives that visited, but they didn't stay inside the house. They mostly stayed outside and social distanced and wore face coverings. None of those relatives became ill. So I think that this really is a good example of all those mitigation strategies, the face coverings, the social distancing, and how indoors is so much more risky than outdoors. And as we're entering into seasons where families want to come together, people want to celebrate with their friends, we know people are getting tired of this. We really have to pay attention to the fact that these are the settings in which people at risk can become ill and become very sick from this, but also this really drives a lot of community spread. The science is telling us more and more. And finally, today I want to end with an update on our vaccine planning. We have been working, as I've mentioned before, for really months now on kind of building the scaffolding around our vaccine plan. We have an early draft of our plan that is due this week to the Centers for Disease Control, and we're really calling it it's the CDC's interim playbook for jurisdiction operations. So this is due Friday. Again, it's a very early iteration of this work. There's still a lot of unknowns that will fill in the blanks over time, but we are working on planning for a variety of different scenarios depending on which vaccines come to our state, how much comes, et cetera. So I'm going to continue to provide regular updates on vaccination during our press briefings as we move forward. There may not be a lot of information over the next few weeks, but we're going to keep providing updates as we move forward. And additionally, I just wanted to share that we will be sharing as much information as we can as we get more information from the federal government. We will begin a process of working with our external partners on that plan, especially the hospitals and long-term care facilities, the health care providers, pharmacies are all going to be extremely important. But also important, and I've mentioned this before, is we're going to need to prioritize who gets the vaccine first. We have a general idea of what that looks like, but it's going to be very important that we work closely with our ethics committee to provide guidance and input on those decisions as we move forward. But the bottom line, we want to make sure Delawareans know that we will not be distributing a vaccine that has not been shown to be safe and that has not gone through the appropriate FDA approval process. And with that, I'm going to hand it back to the governor.
Yeah, thank you very much, Dr. Rattay. Thanks for that good work. Thanks again for explaining the difference between the persons tested methodology, where we have on the denominator 315,000 persons that have been tested, almost 316,000. And then the test administered methodology, which includes the tests multiple times for individual persons, closing in on 500,000, 486,000. And so you can see the difference in how those numbers would affect the measures. And then just showing us that real scenario about the insidious nature of COVID-19, where you have a big family get-together and nobody, it could be the case that nobody is symptomatic, nobody knows that they're shedding the virus, and then 1 out of the 20 people there is asymptomatic and infects several, if not most of the others that are gathered for a long period of time. No mask wearing to protect one another. And that's a good example of the anecdotal information that we hear from our contact tracers about the kinds of situations that folks find themselves in, and then underscores the need for our COVID Alert DE app. I think we're up to 50,000 participants there anonymously, voluntarily in COVID Alert DE, which would let you know in the instance that you gave that if you were within 6 feet of somebody for more than 15 minutes, you'd get an alert and you could quarantine yourself and get tested. So some really great information. A lot of our effort here to contain the virus and understand its spread is determined by our testing, our test czar, if you will. DEMA Director A.J. Scholl is with us today, and he's got some pretty impressive numbers to talk about today. Great work by you and your team, by our county executive and others that have chipped in.
No, thank you, sir, and absolutely. It's been 2 very successful weeks, and we look to continuing that momentum. To just go over some of the testing locations for this week on top of the static sites that we set up in Walgreens and some public health clinics. We have 20 that are already scheduled for this week. Newcastle County will be everywhere from Wilmington to Newark to the MOT area, as well as Newcastle, so hitting all the areas. However, as we push out these flyers, usually in the beginning of the week or over the weekend, please go to de.gov/gettested, as that has the most up-to-date information. Just today, in the last few hours, we've added a event for Smyrna Police Department on Thursday, 10 to 6, Friday at Harrington Fire Company, Saturday at La Espira Academy in Newark, and looks like we'll also add something else on Saturday down in Laurel. So these are a snapshot in time. The training teams between public health and our vendors, the county, and myself continue to add stuff throughout the week. So go to the website. We keep that updated to the minute. Kent County and Sussex County, or yesterday we were at Dover Library with the trailer. A little slower day there because of the weather, but today moved down into the Dover Park area, which is in kind of borders on the area that Dr. Atay identified as being a little bit more of a hotspot. Polytech on Saturday, and then several schools down in Sussex County starting today through Thursday. Milford High School, Beacon, Sussex Central High School, and then Deltech, Georgetown campus. So all of these sites are online. I do want to review one of the registration portals. I believe it's a slide later on in here, but we'll get to that in a second. At-home testing, again, a very convenient and predictable way to get tested. You could request it, get the kit the next day. You go on to do a video chat with a medical provider, complete the test, put it back in the sealed envelope, drop it off at a UPS drop box, and you get your results in 48 to 72 hours, if not before. It all kind of depends if you hit today's drop off or not with UPS. 3 things you need. You need to be a Delaware resident or employee of employed in the state of Delaware. Email address for each individual person. The way the Vault system works is one email address can only have one active test at a time. So if you're doing this for yourself, for family, or the people you live with, they all need an individual email address, and then a smartphone or a tablet for the medical consultation. This is a great way if you don't want to go out to a site, or you're traveling, or you traveled a week or so ago and you want to make sure everything's okay. You could, more or less figure this out on your calendar when you need to request it, when you log on into the Zoom session, and when you drop it back off in a UPS box. So very easy, very convenient for people. Testing, I think we've, both the governor and Dr. Atay have talked about our testing numbers, since the beginning, and it's now we're looking at it at total tests rather than people tested. 486,000, so closing on to 500,000, which I'm sure we'll be at by this time next week. In the last week, October 3rd through the 10th, 34,000 tests. So if you think we had about a number of about 15 and 20,000 a week, which was our high water mark that we were looking at when Dr. Atay and the CDC met in, late May, with the back-to-school testing, with employer testing, with testing the teachers, every few weeks, we've definitely exceeded that number. And it's not just us, it's public health, it's the National Guard, Newcastle County partnership, it's our, the doctor's offices and the clinics that are doing the tests as well right now. So it's a team effort that's really got us to this number, Governor.
Yeah, it really is. And we had what I thought was a stretch goal that we'd never meet of 80,000 a month. At this rate, you can hit that 80,000 goal, which was clearly a reach goal. Obviously, as you say, lots of partners, lots of testing going on, particularly with schools at the University of Delaware, And it makes a difference. It really does, and we appreciate the work. The vault testing, the in-person testing is a great tool. The Walgreens test sites have been helpful, and then Curative has been that backbone of the effort.
No, absolutely. So last month, so for September, the Walgreens sites we're using did just under 15,000 tests. So again, that's just part of the foundation. They're open, either 6 or 7 days a week, depending on the location. A little bit more convenient hours, so that's a good number right there. If you look at just the curative testing sites that we did the last 2 weeks, so we did just under 16,000 week of September 28th, and then 18,300 last week, and I'm assuming we'll be right around that 19,000 number again this week. Yesterday with the weather might have slowed us down a little bit, but it looks like we have a good runway for the rest of the week. So the last point I want to talk about is a company called Mako. It's another lab we're using. I know you've heard of Vault, Curative, and now Mako. Mako is going to be assisting us with doing on-site testing at schools. So as we are doing massive community events for schools going back now, Mako is going to be one of the partners we use on the back end to go back and set up with the school districts, once or twice a month to do reoccurring testing for the students. Just a snapshot here, their testing registration page is a little bit different than Curative. It's a lot of simple information. A lot of the information is pre-filled, so the account number, the name, the insurance information is not needed, so you don't have to click on that tab. It's direct billed to the state. So just want to make sure this isn't something that scares anybody or makes them not get tested. Again, these URLs are unique. You can get them at de.gov/get-tested and register in advance, or register on site, and they're going to be down in some of our Sussex County schools this week and next week. And that is it, sir.
Very good, AJ. Great effort by all the partners. It really is a team effort in all parts of our state. I noticed that you have testing sites coming up in some of the areas where we're seeing a little bit of an uptick in positive cases. You probably couldn't have seen all those various test sites on your screen, so to get more information about where to get tested, it's de.gov/get-tested, de.gov/get-tested. Know your status. Help us squash the spread and win this war against COVID-19. Another tool for everyone in our state is to download the COVID Alert Delaware, protect yourself, slow the spread. It's a voluntary, anonymous app that, as we said a minute ago, enables you to know when you've been in contact with somebody within 6 feet for more than 15 minutes. To know, doesn't tell you whether you've had a mask on or they did, so you just need to be aware of that and know if you get a warning there, an alert, you should make sure that you get tested. It's important as we move into flu season, as I reported when we went over the data dashboard, that we have over 100 hospitalizations today. That's a high number that we like to see be much lower than that. We know we're going to get hospitalizations during the flu season, so let's protect ourselves. Get your vaccine today. That's flu.delaware.gov. You can get your vaccine information, flu.delaware.gov. You might remember I got my shot here on the stage a week or two ago, so I'm ready to go. Okay, get tested, de.gov/get tested, get your information, download the app, and we'll take questions from, we have some media here in the room, and we have just a couple of pre-submitted questions that we'll answer as well.
How are you, Governor?
Thank you, Sarah, for joining us.
Thank you for having me. Dr. Carol Rattay, who is making up the recent uptick in hospitalizations? Is it a certain demographic? Is it younger people, older people, people of color? What do we know?
Yeah, that's a great question. We are diving into that. We have a team of contact tracers that's working with the hospitals to get a better understanding of the demographics around those individuals in the hospital. So far, from early information, nothing in particular is jumping out. We do know that we have some individuals who are from the long-term care facilities where there are outbreaks who are hospitalized. So we know that that is a part of it. But what we believe we are seeing is, we know in late August and September we saw increases in our cases or our case rates as a state, and although luckily that appears to maybe be leveling off right now, hospitalizations is a lagging indicator. So, we think that just through community spread, that is why we now have higher numbers of individuals who are hospitalized.
So, Governor, I wanted to ask you a question about the election. I know that you've been trying to stay out of the process because you are on the ballot, but because of the universal mail-in voting process this year, voters here, like a lot of voters across the country, are very concerned about voter fraud as a result of absentee and mail-in ballots becoming increasingly popular. So I wanted to give you a chance to just address voters' concerns. Is there anything that you can say to voters who are concerned about whether their vote is even going to count?
Yeah, I'm very confident that the Department of Elections and all their folks will be able to count all the ballots, whether those ballots are received through the mail, as is permitted in this election, absentee ballots, which is a normal process, or whether individuals vote in person. We're recommending that those among the vulnerable populations think hard about voting, getting a vote by mail ballot. It worked extremely well during the primaries, both for Democrats and Republicans. We know there's considerable interest in doing that because we know the number of people that have already requested absentee ballots. It's down a little bit, as I understand it, from the percentage, a relative percentage on the primary side. Some of that we think is a function that there's been some confusion around whether people's ballot would be received on time. We do know, in talking with the folks from the U.S. Postal Service, is that if anybody's going to vote by mail, they should get their ballot in the Friday before the Tuesday on Election Day, November the 3rd, so that previous Friday. If they don't get it in by then, they can deliver it to the drop boxes at their county election offices up to close of business, close of polls, 8 o'clock on Election Day. Yeah, I'm very confident. I'm not as concerned as you hear some about a voter fraud. I'm concerned more about people forgetting and not getting their ballot in. We do know also that there are a number of folks who requested a vote by mail ballot in the primary and didn't follow through. We'd like to see those people follow through, whether they're Democrats or Republicans. And I'm pretty confident, and I know the new machines are great. They're much more secure than our old system. They do have a paper ballot trail. And so if you think about all the things and compare our readiness to the election coming up with where we were in the election 2 and 4 years ago, I think we're in a much better place, particularly in 2016 when we had all this interference, which has been documented by foreign players, the Russians and others. We have a pretty contained perimeter. We did get attacked there in 2016, but we're much better positioned. And I would just say to folks, particularly those who are at risk and vulnerable, to get a vote by mail so that they don't have to take that risk in going out to a polling place on Election Day.
Do you mind if I ask one
And
more?
by the way, I did look at the totals in the primaries. And the primary vote in this past September, just a month ago, was, and I'll just take one geographic area, Newcastle County, on the Democratic side, twice as many people voted as voted in the primary in 2016. So a lot more interest. Obviously, there were more primary contested primaries this time around, and even in the city of Wilmington, 2,000 or 3,000 more people voted.
Do you mind if I ask one more question? I
Sure.
just got an email from one of my colleagues who wanted me to ask you this related to the recent incident in Michigan with their governor. He's asking, because you are also a Democratic governor, if you are planning on beefing up your security.
Yeah, I probably shouldn't talk specifically about it or about any specific risks, but it is concerning what we saw in Michigan for sure. The idea that here in the United States of America, we've come to this, to fear for the safety of our elected officials is really a sad statement. I think it's a statement on our political culture and the folks that cultivate that kind of feeling. And I believe, and it's my approach has always been to try to find common ground as opposed to taking advantage of those things that divide us. We have way more in common and then we do things that divide us, and it's really sad and a little bit scary that it's come to this with these anti-government militia that are threatening Governor Whitmer in Michigan, and I understand Governor Northam in Virginia. It's just hard for me to believe that it's become our political environment is that contentious that it would come to that.
Thank you so much.
Mm-hmm. Thank you.
All right, this first question is a little similar to before, but this is from Howard Monroe from CBS 3. Are you convinced election officials will be able to count every vote cast, whether in person or vote by mail?
Yeah, I'm completely convinced of that. I don't think we have the challenges that other states where there's that kind of discussion going on. It will be a little different or a lot different because a lot of people will vote by mail, which is the safest way to do it. I'm certainly going to encourage my mother, who's 89 years old, to vote by mail so she doesn't have to take that risk. And I think we should all think about our elderly parents and grandparents in that regard. But no, I have every confidence that votes will be counted. Again, we have much better in-person voting machines with a paper trail that so many people have wanted over the years. I think our perimeter, as I said a minute ago, our technology is much better. It does take a little getting used to the way the ballot is structured in the machine, and so it takes a little bit more time. I expect a tremendous turnout just based on what we saw from the primary, and so people should think about maybe getting there early or voting by mail just to avoid long lines on Election Day. But I have every confidence that we'll be able to count every ballot.
Next question's from Sean Green at WDEL. A statement on My Healthy Community says using the percent of tests that are positive is a more useful measure to make operational decisions, while your reopening school plan is still using the higher percent of persons testing positive. Percent of tests is 2.5% on the rolling average. Shouldn't Delaware schools be in the green right now?
Yeah, but I'm going to turn it over to Dr. Rattay to talk about the specifics, but as I mentioned earlier in my remarks, that we've been communicating on a regular, almost daily basis with the school superintendents, and each of them are looking at the data dashboard. And our advice to them is, the data dashboard was to be a guide as we reopened schools and created, 3 different scenarios. One where everybody would be in remote learning, yellow where districts were encouraged to be partially remote and partially in person, which, by the way, they kind of have to do initially just to get kids gradually back into classrooms with fewer children in each room. And then the green scenario, which we're not quite ready for yet, either at the school building level or with respect to the health on the ground. But we've also said that we want to look at all the data to really better understand, the number of new positives on a daily basis, where they're concentrated, whether they're cases from nursing homes or from our prisons. I mean, all these factors play into it, and we'll be thoughtful about to making that evaluation. We'll continue to use this new methodology and kind of make determinations about what it should signal and when.
Yeah, we're spending a lot of time right now looking at our metrics and making sure that that they best reflect community spread and response. This new metric, as we have seen percent positives is lower with this new metric in comparison to the older metric. And so again, it's important that that all of our metrics appropriately reflect what's really going on. We created these metrics and the thresholds in July. Since that time, for example, Centers for Disease Control and others have come out with different plans. So we're taking a look at some of the different approaches to make sure that we really are fully painting the most complete, best, but also understandable picture of really what is going on in our state. But as the governor said, I mean, really, we feel very strongly, especially with some increases in case rates in September and now increased hospitalizations, we are solidly in the yellow. So we are not in green at this point in time for sure.
All right, so the last question from Tom Lehman at WBOC. This question's for Dr. Rattay and AJ. Wesley College is getting testing kits from the state and Teach for America. Could you talk about the state's work with the college on preventing the spread of COVID-19 and any concerns there might be with the coronavirus on that campus?
So I'll start and then turn over to Dr. Rattay. We've probably about a month ago, the governor started weekly conference calls with the leadership of all the colleges. It's been very educational for all of them to understand, how they are developing a culture on their campus to keep everybody safe. And President Clark and I have had a few conversations, as well as I know the governor's talked to them. They have a little bit smaller footprint than DSU or University of Delaware, which I think made it a little bit more easy for them to get over to some of the community sites. We've had community sites at the Del Tech Dover campus weekly for several months that they've been utilizing. There's a Walgreens that is right off campus. We have provided 1,000 test kits to them. Del State provided some of the antigen testing kits I'll let Dr. Rattay talk to about how they're going to use it. We'll be doing an on-site testing event there, I believe, the last week in October. We've been working on some dates. But I think if there's one thing we've seen from President Clark, it's really a culture and education that they've done with their faculty and their staff and their students to really beat this as much as they can. And we'll support them any way we can going forward.
Yeah, I don't really have much to add to that. I mean, I think that Wesley and Del State UD have all really leaned into this, and the culture of controlling infection spread at Wesley, as well as getting individuals tested. As AJ said, they've really been looking to local testing so far, but we are working with them and have provided them testing to do on-site testing. So, we really feel that they are on top of this, and they have been from the beginning.
Yeah, we've had regular conversations with Wesley, Delaware State University, and University of Delaware, and we saw, as you saw some of the data earlier, the number of positive cases has been going down at the University of Delaware. Each of those institutions, as AJ has said, have really been serious about their efforts to create a culture where folks are protective, they wear masks, they avoid social distancing. There has been a little bit of an issue with off-campus partying, which we know is a problem, but they've taken that seriously on each of the campuses, and so far it looks like we've been able to have some success there. So that covers it for today. Just before we sign off, I'd like to remind everybody about downloading the COVID Alert Delaware app so that you can know when you've been in contact with somebody who's tested positive. It is anonymous, it's voluntary. It's not all inclusive because it only includes those others who participate. So it will give you an alert, a warning if you've come in contact with somebody who tells the Division of Public Health that they've tested positive, and they trigger the app, and so you'll get a ping to let you know that you need to quarantine and get tested as well. So it's a really helpful tool. We've got 50,000 Delawareans who've downloaded the app, and so they're helping protect themselves and slowing down the spread. Again, just to focus on our overall objectives, getting our economy reopened fully, getting our children back in school in front of teachers in person, remain our two major goals. We're moving towards those goals. We're doing better this week than we were last week, things are flattening out and hopefully turning in the opposite direction. There is some concern, again, about our higher hospitalization numbers. Could be a lagging indicator of some of the COVID spread among nursing home populations. But we're going to continue to fight the fight, and we need your help as well. So thank you very much, and we'll see you next week.